Dr. Richard Cash, a name synonymous with public health innovation and dedication, left an indelible mark on the world. His pioneering work on oral rehydration therapy revolutionized the treatment of diarrheal diseases, saving over 50 million lives globally. In the late 1960s, as a young medical officer in East Pakistan, now Bangladesh, Dr. Cash collaborated with other brilliant minds to perfect ORT, a simple yet life-saving solution of salt, sugar, and water. His work became a cornerstone of child survival around the world. Dr. Cash had a connection with Bangladesh that ran deep, from advocating for its independence in 1971 to shaping its public health landscape. He was honored with the Friends of Liberation War Medal for his unwavering support. He also won the Prince Mahidol Award and Freeze Prize for his contributions in global health. As a founding contributor to the James P. Grant School of Public Health, Dr. Cash championed community-based, problem-focused learning. His courses in our MPH program, especially epidemiology of infectious diseases, which he jointly coordinated with Dr. Steve Luby, inspired countless students from across the globe. He was more than just a teacher. He was a mentor, a guide, and a source of inspiration who earned deep respect and affection from his students and colleagues alike. He selflessly donated his honorariums to enrich student experiences, ensuring their growth extended beyond the classroom and into transformative opportunities. Let's hear from his beloved colleagues and friends.
The passing of Richard Cash is a big loss for the world, and personally for me, and as an organization of which I was a part. It is a big loss for BRAC and the BRAC School of Public Health. I have known Richard for 45 years, and he was like a brother to me. He was a great friend and a great mentor. I learned so much from him, and I have no words to express that. He was a wonderful human being, and I remember the first time I met him when I accompanied him to a field program of BRAC where we were piloting the oral rehydration program of BRAC in Baniachong sub-district, Upazila of Bangladesh. And I was amazed to see how he behaved with the local situations. He was an American, but I found him to be very sympathetic to the problems that the poor people of Bangladesh were facing at that time. He was also a person who not only supported our work, but also promoted that across the world. And I think many of the things that we have achieved at BRAC, and of course the BRAC School of Public Health, are due to what Richard did for us. He contributed a lot to Bangladesh, to the world of knowledge, and needless to say about ORT, which has already saved millions of lives.
Richard was in our lives for 30 years. He was our landlord during our time at Harvard, the godfather to our son, the adoptive uncle of all three children, an intellectual partner, a colleague, and the dearest of friends. I taught the intro course with Richard from the program's inception till about 2016 or so, and we had a lot of fun. It's a huge delight in seeing our students energized around learning, caring about the world, and it was wonderful. Every evening we'd walk around and around the perimeter of the Savar campus in the early days, talking about books and ideas and world events, our adventures, simple pleasures and plans for the future. Another fond memory of mine was preparing him for the Prince Mahidol Award in Thailand. Although he fancied himself a doyen of PowerPoint etiquette, and we all remember his famous talk on how to give a talk, his slides were a disaster. We made them beautiful and rehearsed his backwards walk because you never want to turn your back on a king. The palace pomp and ceremony were really not his style, but he was chuffed, and so were we. He glided up the aisle in tuxedo finery and received his award from the king, and then retreated backwards and didn't trip, so I was pleased. In between were thoughtful emails and book recommendations and occasional visits. Richard was a Renaissance man with an unquenchable appetite for learning and teaching. Even when he was dozing in the back of the classroom, he was listening, stirring himself to make a brilliant point and then slumbering again. Teaching was his passion. The humble line, he'd stalk back and forth, stopping only to ask a careful question, and then taking time to value whomever responded. He listened deeply and never judged. And we would do well to foster these wonderful qualities in our own lives.
Richard Cash was a dear friend of mine, a dear friend of BRAC, and a dear friend of all of Bangladesh. We all benefited from his contribution, from his work on oral rehydration solution, both the original research and collaborating with BRAC to spread this out across the country. His work advancing the way we think about ethical issues in low and middle income countries, and his many contributions to the education of students, both at Harvard and at the James P. Grant School of Public Health in Dhaka. I miss Richard deeply, but I consider myself fortunate to have known him. He has shown us how to live a full and meaningful life.
Richard was a very, very dear friend and a very close friend. I've known him, I met him in end of 93 when I was at BRAC's Research and Evaluation Division. We've remained friends. He was a close friend to the school. He taught in our program since its inception. In 2004, in fact, he was involved in the initial design and thinking through of the school. I admire a lot of things about Richard, but one thing that struck me is that he always walked his own path. He didn't do the conventional public health kind of requirements. He was ambitious, but for communities. He was ambitious to create change. He was ambitious about real world solutions to problems. And that's why, he was awarded the Prince Maidal Award for ORS. But he changed millions of people's lives. And he just walked his own path. And usually public health, or most of our kinds of disciplines, have a very sort of conventional kind of career trajectory. But I like the fact that he didn't conform, yet he, actually created changes. He was someone I will cherish deeply. He supported me, he supported the school, and I will miss him.
The legacy of Dr. Richard Cash is not just in the millions of lives he saved, but in the countless hearts he inspired. Through his groundbreaking work and unwavering commitment, he exemplified that simple solutions can create profound change. To the students he mentored, the communities he served, and the colleagues he uplifted, Dr. Cash was more than a pioneer. He was a beacon of hope. As we celebrate his life and legacy, we honor a man whose impact will forever echo in the world of public health. Thank you, Dr. Cash, for showing us what it means to serve humanity with humility, compassion, and brilliance. Your legacy will be carried forward by the millions of souls you've touched in your